Hey guys, DocBox here again. So this is another blah 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 vlog, but this time is about a very serious issue. Okay, as you would know, weeks ago there's been a social media post by a celebrity who shamed a doctor in the province due to her supposed lack of empathy and poor management skills. Okay, so this is to set things straight and give you a bit of what doctors have been going through. So to be a physician, you have to undergo 4 years of college, or what we call pre-medicine. Okay, so any kind of course would be a prerequisite to medicine. Then after that will be the medicine proper, will be another 4 years. But in some institutions, there's called an innovative course, which you have only 2 years of pre-med and 4 years of medicine. So it's gonna be like straight medicine course of shortened course to about 6 years. Then after graduation, okay, there'll be a mandatory 1-year internship. So we're gonna get to do what we were doing during 4th year all over again, this time with the lesser load. And then after that, we have to study our asses off for the board exams. Then after board exams, okay, so we are now physicians already, but some would opt to do a specialization, which takes another 2 to 5 years of your life depending on the specialty. Okay, usually pedia and IM are shorter than surgery, and or surgical specialties are the longest. Okay, then after your specialty, there would be another 1 to 2 years of subspecialty of your choice. So you could already imagine the years lost in our lives. Some would say it's an extended college, but instead of earning, okay, so most of our peers already are earning, have their own houses and cars. We are still at school, grinding our asses off. Besides duty and attending to patients, we also do student stuff like reports. In our case, we call that grand rounds, research, and even admin duty for senior doctors. Okay, all within a range of 8 to 33 hours. So we are sort of like working students. Okay, so imagine the 4 times the stress due to lack of sleep, under constant pressure from both senior doctors and patients to minimize errors as much as we can. To summarize, we've been through a lot just to get the suffix MD. And even though we're already practicing medicine, life does not get easier, especially those in the hospitals. Okay, so I opted not to work in a hospital setting anymore because, as lazy as it might sound, I don't want any additional stress anymore. Okay? I chose my health and my family over long duty hours and sometimes a-hole consultants. But those in hospitals, in this case public hospitals, they fare not so much. Besides the patient overload, okay, you can see patients even in the halls just to get medical attention. There's also inadequate staffing, nurses that go to abroad just to get a higher pay or salary, and even lack of hospital funding, okay, from the government, so which results in poor equipment and facilities, most notable in the provinces. So to compensate for all of that, doctors sometimes do unorthodox methods, using whatever is available at the hospital and improvise on whatever resource they have. I even know some who gives money to patients just so they can buy their own medicines. So that's how miserable our health system works. So to our dear patients, try to understand what we have been through. Trust our experience and expertise in treating your illness. If we have attitude, we are sorry, but we don't take it personally on you. I know some doctors who really have a somewhat unfriendly attitude or approach to patients, but believe me, every patient we have coming through our doors, whether it's a clinic or the hospital, our brain starts working immediately. Okay, and sometimes after long shifts, we also get ticked or tired.
All right, I'm a little tired, I'm a little wired, and I think I deserve a little appreciation.
Also, but we never want to harm you or do harm to you. Okay, we still think of your welfare. I for myself, okay, it's already in the company setting. All right, I've been confronted with many incident reports regarding how I approach the patients. Usually I elevate my voice to hammer my point, but it's still in a rational way and with the best interest of the patient. Okay, because we swore an oath. Okay, an oath to do no harm. We spent years building our practice, then with a simple maligning post, it can easily be shattered. Okay, so please don't post in social media. You can tell your concerns through a help desk or even directly tell that to the person involved. Besides, there's an existing law about bullying. Okay, it's RA 10627, Anti-Bullying Act of 2013. Okay, so it covers all kinds of bullying, even cyberbullying. I support the hashtag #notodoctorshaming, but I also advocate new hashtag probably. Okay, hashtag #no-to-shaming at all. Okay, no to shaming everyone. We all are going through something in our lives. Okay, a lady in the counter of a fast food restaurant giving incorrect order. Maybe she had problems about debt or personal life. Okay, a traffic enforcer stopping you for a ticket. Okay, imagine he has been standing in long hours in the road through sun and rain. Okay, even a celebrity. Okay, they were rehearsing countless times and then still couldn't get optimal performance that the audience should deserve. So we all deserve even just a little respect. Okay, so hashtag #no-to-doctorshaming. So thank you very much for my editorial. Okay, please subscribe and share. Okay, so regular programming will resume the following vlogs. Okay, so thank you very much. Okay, this is Doc Box signing up. Peace.